I think anyone living in Appalachian, Kentucky has known that the substance use disorder epidemic has been a problem for a considerable amount of time. I mean, back into the late 1990s, really the OxyContin issue became a big problem in our region. But it wasn't until about 2016, there was an instance where within a brief amount of time, there were 10 overdoses in Rowan County, Kentucky, which is where St. Clair Healthcare is based.
During that time, there was a stigma for treating these patients. If they were ongoing and active IV drug users, quite a few of the specialists that would treat hepatitis would not even consider treating this population, mainly because of the cost of the drugs and the fact that they could then be considered to be reinfected because they were continuing to use. So I noticed in this group that they were very discouraged by the amount of care that they were receiving, not only for the hepatitis C, but also for the addiction, with the stigma surrounding addiction and the treatment availability. This group was very discouraged. Some of the younger providers that had just gotten out of residency were feeling overwhelmed with the amount of polysubstances or multiple controlled substances that patients were taking and being prescribed. It came to my attention the number of patients who were not necessarily needing the medications that were being prescribed, were taking them in manners that were not safe, and taking basically too many medications, and in fact had an underlying substance use disorder. So at that point, we began to interview a psychiatrist who was working at University of Kentucky, who had an interest in buprenorphine or the Suboxone type clinics, and she was doing a fellowship in addiction medicine. So during that time of interview, I said, would you be interested in starting a Suboxone clinic here, or an MAT clinic, an MOUD clinic here at St. Clair? And she in fact was very interested, very excited about that. So during the time that she left UK and came to St. Clair, we put together policies and protocols, and started our own buprenorphine medication-assisted treatment program at St. Clair, at the St. Clair Counseling Center. So the providers were able then to spend more time during their patient visits talking to the patients about the actual health care, about their actual needs for health care, and allowed the providers that were participating in the MAT, the medication-assisted treatment, to focus on the substance use disorder and treating that patient, getting that patient into their recovery, and focusing on the addiction side of that. So what we saw was an improvement or an increase in those patients coming to the program, being involved, decreasing the number of controlled substances that they were on, improving their safety profile, and being much happier with their quality of life. Many of these patients lose their children and have lost custody to grandparents or their cousins even, or foster care. We have seen an incredible 25% plus the need in foster care for this group of patients and this population. So to see them work with the Cabinet for Women and Children and the drug courts and their probation officers and get their children back has been a big part of the joy of being able to deliver this type of treatment with the medication-assisted treatment. One of the biggest barriers that I have seen with providers wanting to provide this service is lack of knowledge, which creates a disrest or a discomfort, and also the amount of regulations that a provider has to follow when prescribing the buprenorphine type products. So by developing an educational program where we can relieve some of that angst or distress or discomfort and teach the providers and show them exactly what needs to be done was a big part of the program that AHEC has developed in getting providers more comfortable and willing to get their X waiver and treat these patients with the buprenorphine type products.
And we had an incredibly low number of providers that had the waiver in order to provide to prescribe Suboxone within the region. Very low number within the 17 county region that AHEC serves. So when we started the educational initiatives, it was really topics focused on just what is medication-assisted treatment. What is, we had a topic that was called the disease of addiction, just to reemphasize to providers that how big a problem addiction was in the region, that in many cases it had been overprescribing of medications that had led to the issues within our region. But we found early on that there was a lot of interest in that topic, and we had success early on in terms of allowing providers within the region to attend a few educational sessions and then obtain their waiver to prescribe Suboxone. The medical director for the Gateway District Health Department came up with the idea for what we're calling an MAT training resource center. So he said we need to come up with a training that is focused just on those who have gotten this waiver and aren't utilizing it yet. So with Dr. McLean and some of her partners, we put this training resource center together, where we've done an MAT boot camp and other trainings. We have an MAT mentorship initiative where Dr. McLean works directly with a cohort of providers that, again, have gotten the waiver, and we're hopefully transitioning them toward being able to utilize it. But it is a major undertaking within our region. It's required a great deal of attention, but it's worth that effort.
Admitting that you have a problem, that something else controls your life, takes a great deal of courage. So anything that can help someone face that and admit that and get their life onto the path of recovery is going to be a tremendous move forward for not only that patient, but their family and their community. Working and hearing their stories and hearing their cries for help and answering the questions and being a part of the solution was a big part in transformation of me going from basically not understanding and not knowledgeable about addiction to becoming an addictionologist. They come to you needing a tremendous amount of stability in their life. And the rewarding fact is when they do create that stability and they get into their recovery, and then they're able to get back into their life, they're able to have those relationships that they were destroying prior when they were using. They're able to get their job back, they're able to get their children back, and they are some of the most grateful people that you will find, and happy, and want to come see you. They want to be at that visit. They want to be a part of what they're doing to get their quality of life back. Their stories are incredible, and they are so grateful. And that is very rewarding from a provider standpoint, seeing that and being a part of that.